That is such a key point, because one of the ways that I've learned that we can really help people boost their self-esteem is helping them realign with the reflection that they're seeing in the mirror. So when we do aesthetic work ethically, elegantly, conservatively, and we help the patient look in the mirror and say, yes, that is me. That's me. That is the true beauty of helping people boost their self-confidence.
Welcome to the Double Down podcast with Dr. D. I'm Dr. Paola D'Aleman, a triple board certified MD with a passion for helping you thrive at every stage of life, from your first steps into wellness to navigating menopause like a pro. Whether you're tackling weight, mastering menopause, or leveling up your health, this is your go-to space for transformation. It's time to double down on your health and your life. Let's get started.
Hello, and welcome back to Double Down with Dr. D. I'm Dr. D, triple board certified physician, a Latina in perimenopause, a big believer that authenticity is the path to freedom. And I will invest in my self-care and my well-being forever. Today, as part of our menopause series and our talks about midlife, we are going to discuss beauty everywhere, basically beauty and aesthetics. So wow, aesthetics, always dismissed as something superficial, something that is like only people who is too much into themselves. But aesthetics goes beyond that. And we all have to accept that we do care about aesthetics. And it has a subjective meaning, aesthetics. But it's so powerful, yet so self-judgmental, or even we judge others about it. So today, I wanted to invite someone fantastic that knows everything about aesthetics, and she can dive deep into why aesthetics is at its core. It has a lot to do with self-care. We're going to welcome Dr. Mari Salazar. Mari Salazar is a physician assistant with 20 years of experience in the field of dermatology, plastic surgery, aesthetics, now hormonal replacement therapy. And she graduated from FAU, Florida Atlantic University, and a master's of medical clinical science from Barry University. Her practice is dedicated to approach the individual from the inside and find any deficiencies, micronutrient deficiencies, replace them when needed, and as well to performing aesthetics treatments. She's the founder and the CEO of Indie Health, a beauty practice that is dedicated to make you feel confident in the way you look and to live vibrantly healthy. Welcome, Dr. Mari Salazar, to Double Down with Dr. D.
Hi, Dr. D. Such a pleasure to be on here. I'm always happy to speak with you.
Mari, today we're deepening into this fascinating intersection of beauty, self-worth, and with someone who truly understands how the art and science of looking beautiful inside and out. So my first question to you really is, in this moment in midlife, we are always looking for aging gracefully, but it's always that little line on aging gracefully versus trying too hard. So let's talk about beyond the wrinkles, this new perspective of aging. Tell us, how do you guide your patients in making a realistic decision and looking natural beauty instead of looking a little artificial?
Wow. So that is a big question, because a lot of that depends on the patient coming in, right? Some patients come in for the very first time in midlife, and they want to take very conservative approaches to enhancing their beauty. And other patients come in and they've already had quite a bit of work done. And that means that my job there is to hold back and try to restore a more natural look, right? So expectations change based on the patient. Some of us have just very unrealistic visions of what beauty should be. And which brings me to another important point, picking your provider, right? So you want to, and that's why I think me and you have always gotten along so well, because we do have the same vision of beauty, right? We have a natural, balanced, aesthetic vision of beauty. And that's what I try to give my patients. I mean, we need to understand that looking youthful does not mean having no wrinkles. You know, we've all seen that woman
Right.
walking down the street and we don't think, wow, she looks so young, right? We think, oh, she looks a little bit overdone, like she's trying too hard. And what I try to explain to people is that looking young is an inside out process, right? So of course there's procedures and things that we do externally to help, but truly looking young is an inside out process where we are vibrantly healthy, where our cells are radiating health, where we are glowing from within. And that makes my job a lot easier to kind of soften wrinkles and restore volume. But yeah, patient expectation is something that every practitioner has to manage very carefully. And hopefully patients fall into the right hands, because you know, things can get out of control pretty quickly in the world of aesthetics.
Yes, and you touch a very important point. Well, two important points from my perspective. One, aesthetics has a meaning a little subjective, right? But at one point, you need someone that you can trust and with no interest can almost give you their perspective of what aesthetics should look to you. And that's important because yes, you can lose that perspective out of how the world judges you. So that one person there for you, that relationship with that one person, I find that it is essential. You just mentioned it. And the second part, from the inside and out, and you say always that skin is the mirror of internal health. So you tell us a little bit about how you start that process of like that workup of what's going on within you, so I can start fixing what is fixable and slowly arrive to the surface that is what you're going to see in the mirror.
Yes, absolutely. Skin is a manifestation of what is happening on the inside. So the healthier we are on the inside, the better our skin looks and the more youthful we look. Because what I explain to people is that health is beauty. So after probably 15 years, I've been in practice 20 now, but after about 15 years of just injecting, just doing treatments on skin, I decided that we needed to work internally. So we do blood work. You know, we need to look for deficiencies in midlife. We may have deficiencies in hormones, in vitamins, minerals, amino acids, antioxidants, and those are the tools, right, that our cells need in order for them to perform their job. Each one of our cells has one job to do. And in order for it to do that job optimally, it needs its particular set of tools. So when we restore or replete those deficiencies, everything works a little bit better. So if that cell's job was to produce hair, our hair gets better. If that cell's job was to produce muscle, our muscle gets better. If that cell's job was to produce collagen, our collagen gets better. So once we've restored all of those deficiencies internally, you absolutely see that externally, which then makes my job of injecting and improving quality of skin so much easier. It's a lot of fun work. I think that when patients understand that they have the ability to restore these things, they take much more ownership and responsibility over the aging process and not just a quick Botox treatment, which most likely they will not be happy with, because if their skin is blotchy and they look dull and eyes look dull and they're just not healthy and they're lacking estrogen, or they're lacking progesterone, they it's a treatment done halfway. It's not a full treatment.
Yeah, I love it. This is the way how we do a holistic approach to aesthetics, which is such a thing,
Yeah.
because that includes as well your mental wellness. And it's about how even arriving to a point that someone feel that they are looking good and they can present and show up in the world the way they were always dreaming or going back in they were who they used to be. It's very empowering. So for me, this aesthetics, this art of balance that you provide, it's also helping the patient to navigate through their mental wellness.
Absolutely. That is such a key point, because one of the ways that I've learned that we can really help people boost their self-esteem is helping them realign with the reflection that they're seeing in the mirror. What happens to us in perimenopause and menopause and postmenopause? That we'll look in the mirror and we just don't even recognize ourselves sometimes. And that disconnect can be very disheartening and confusing to us. So when we do aesthetic work ethically, elegantly, conservatively, and we help the patient look in the mirror and say, yes, that is me. That's me. That is the true beauty of helping people boost their self-confidence, that realignment, that reconnection of seeing the way that you want to feel.
I love it, Mari, because I have to tell you, since I'm in this field, in the field of medicine, right from the beginning, I'm a big advocate of trust, but I never imagined like you need to keep trust with your aesthetic specialist. Yes, you trust their hands, you trust that they know what they're doing, but not to the point of like that confiding this very deep precious private life. But I see the relationship that arriving to a provider like you, starting to create a relationship, getting that like I trust you, I believe in you, what you're telling me, I take it, because you are going to be a better judge of the way how I look, more than my best friend or the mirror in the morning. And then next you tell me, let's start with how your own body is going to help us to go through this process. And this is when you go inside. And then whatever we cannot replace or supplement or having a response after making a decision on certain vitamins that you are requiring, then it comes the treatments that are available, that we all are very grateful that they exist. But then is the whole relationship at the end. And I'm coming to my next question, which is awesome, and is who you are, your philosophy, how vibrant. I love that word. I told you that totally describes you. Like this, how you are right now with your beautiful mustard yellow sweater. That vibrant Mari Salazar that is on the other side, because there is always a sense of identification with the person that it is treating you. So once we create all this process and engagement between you as my provider and me as a patient, and I relate to you, then I can almost feel this, that is therapeutic. So
Yes.
tell us about your personal philosophy on that beauty and aging, which is what I'm going to relate to for the future steps.
Yeah. Well, I think that we all understand that there can be many versions of ourselves, many versions. And if we are lucky enough to have the education and the disposable income and the energy and the want to do it, we need to strive to be the best version of ourselves. And, like as we've been talking since the beginning. That means internally and giving yourself all of the tools that your body needs to be as optimal as possible. Like we said, when it comes to micronutrients and hormones. And then, externally doing the fun little stuff that we get to do in the office, like Botox and fillers and microneedling and collagen stimulating treatments. The combination or the marrying of those two things helps us be a better version of ourselves, because it also helps, like we said, with our self-confidence, with the way that we look at the world, with how we portray ourselves to the world. Beauty is about energy. Beauty is about radiating a positive energy that makes you attractive to the world and attractive to all types of energy. And that's my philosophy in the practice. I focus a lot on very natural results. I think that unfortunately there is a lot in my profession of people doing things in a way that just exaggerate features, and we become caricatures of ourselves. Remember those caricatures people draw in the in the theme parks? I see so many people walking around looking like a caricature of themselves, and they lose their beautiful genuineness. There is beauty in some asymmetry. There is beauty in some imperfections. We don't have to strive for that perfection. We have to strive to look rested, to be healthy. Rested is an important thing. I mean, how important is sleep, right? And so many of us don't get good quality sleep. That's one of my number one beauty hacks, figure out your sleep. Because if you're not sleeping, you're not restoring, you're not detoxifying, you're not rejuvenating. So sleep is number one beauty hack. Other things that I do personally, is skincare for sure. Consistency is key when it comes to anti-aging. So in the morning, a good antioxidant, a good sunscreen. In the evening, a little bit more involved. You want to really cleanse the skin, you want to massage, you want to invigorate, you want to increase blood perfusion to the surface of the skin. Blood is what's bringing oxygen and nutrients and hormones to your skin. So I'm a big believer in just stimulating stuff, getting your skin pink. And after that, a good chemical exfoliant, some kind of glycolic, some kind of alpha lipoic acid, alpha hydroxy acid, some kind of retinol, and then massive moisture, because as perimenopausal women, we feel dry, right? Yeah. So massive moisture at night. And another beautiful thing that I've learned, which was very difficult for me years ago as a young mother and not having a lot of time, is the beauty of the ritual of self-care. Really enjoying spending time with myself in front of the mirror and taking care of my skin, which, by the way, has extended down to my neck and arms and chest, because I've noticed aging even on my arm skin, which has been completely neglected, right? I always neglected my arms, and now my arms are bothering me. But the beauty of the ritual of self-care, and I really like spending time with myself now, and I think that when we give energy to anything, it improves. And I've noticed that when I give energy to myself and my skin, it improves.
I love that concept. You see, holistic again. And you touched a little bit of my next question, because as a board certified lifestyle medicine physician, I have to come up and say, yes, agree with you going to the root cause, more like the functional doctor one that is looking for the supplements, minerals, vitamins, whatever we're missing. What about other lifestyle choices that we can add on into our ritual that for sure is going to show up in our face as almost being grateful for doing it beyond our sleep? Absolutely, I agree 100%. It's any other tips from a lifestyle medicine kind of pillars that you can just grab on?
Yeah, well, I mean, I do a lot of things. I put collagen peptides in my coffee. I make sure that my protein intake is on point, So I count my protein throughout the day. I want to get around 100 grams at least of protein a day. I take creatine for my muscles, my brain, my skin. I take a lot of supplements, omegas, vitamin C's are crucial to stimulate the production of collagen, methylated B vitamins, probiotics. I exfoliate. I exfoliate my skin. Like I said, in the morning, I'll use an antioxidant always in the morning. And that changes because I'm always trying different things out, but I will always use an antioxidant in the morning and sunscreen. And then in the evening, I'll use some kind of exfoliant to help slough off the dull, dead skin. And those are the things that I do most consistently. And then once in a while, of course, I do in-office procedures. I'll do a micro needling. I do Sculptra, which I love. I do my Botox, obviously, at least 3 times a year. Those are the main things that I do.
But what about the rest of the pillars? I want to know about your diet, your nutritional approach to your skin health, the exercise. That exercise will have an impact.
Yes.
Toxic substances that we take. Absolutely, we all enjoy a glass of wine, but how, moderation, etc. I would like you to comment on that.
Yeah. So my like I said, with my diet, my main focus is trying to get my protein intake to be at least 100 grams of protein a day. I hydrate a lot. I do electrolytes with my creatine in my first thermos of water throughout the day. Obviously, exercise is key. Again, not just for muscle growth, which at this stage in our life, I think that, strength training is the best type of exercise. I don't do a lot of cardio anymore except walking. I feel like I am doing cardio when I'm lifting weights because my heart's going to explode out of my chest, right? So that's the type of exercise that I do. What was the other questions?
So toxic substances, like
Oh,
the glass of wine.
of course, yes. We all have our glass of wine. I go out on the
Yes.
weekends. I have cocktails with my husband. I'll eat dessert with my kids. If I do feel like I am going to have a little bit more alcohol than I should be having, I take some glutathione. I make sure that I take my electrolytes, drink lots and lots of water to help flush out the toxins. But yeah, I'm not somebody who says no to those things. I've become somebody who says yes to life.
Yes.
Yes, I'm not militant on anything. I think that there is value to being social and to enjoying a glass of wine with one of your friends. And that brings value to my life. And that makes me happy, and happiness is beauty as well as health is beauty, right?
I
So
love it because yes, that answered the questions on how we identify to you, right? And if it balance, holistic, yes, there is things that are not ideal, but if we avoid, if we're so limiting in our day to day, then we fall into another kind of world, which is a restrictive world, which
and
doesn't make us
stressful
happy.
and stressful. If my diet is going to stress me out, or if toxic environments are going to stress me out, then that doesn't help me at all. Like the other day, and I don't know if you're going to want to put this in here, but the other day I was listening to somebody say that, oh, everything now there's microplastics and this and that, and now you have to be careful with your tea bags because tea bags have microplastics. And I'm like, oh my God, I refuse to
Yes.
be scared of tea bags. I No, I'm not going to live my life like that. I'm going to be as healthy as I possibly can be, but fear is not going to be part of my decision-making process.
I love it.
Yeah.
Love it. And what you can control, fantastic. If you cannot, you cannot, when the strawberries are organic and I can buy them, fine. When I can't not grab them because they are not in the supermarket and or they are $15 a box because they're organic, then I would say, okay, maybe it's okay to eat not organic. I totally agree. That's the message I pass to my patients, because then it becomes a life of fear, a life where you are walking on eggshells no matter where you're going.
And scared of tea bags. No.
No, scared of tea bags is not the philosophy of Dr. Mari Salazar. That's
No.
for sure. Well, you've been very generous sharing everything that you do in your rituals, and not only what you do for your patients, but what you do in your rituals, because we would love to look like you. I mean, you guys, if you're not seeing this as a video and just as an audio, you have to Google Dr. Mari Salazar AMD Health, because she looks absolutely gorgeous, fantastic, and vibrant. Because I agree, is the energy that it comes out of you, it comes as youth. It doesn't matter what age you are.
Yes.
And it's a wholeness. It's not in a vial. It's not in a vial. It's not in a machine. Those are just tools that we can have. And I'm a big believer that self-care, it is part of our well-being in general. And especially now that we're going through this midlife, where we start questioning many things. So my idea with this podcast, Mari, is to empower women to have midlife as an opportunity of transformation. And since we have so many experiences already, and we really believe that we already created important things in the world, we're not having all these questioning that we had when we were in our early years, teenager years, or young adults. Now we know a little bit more about life. We can almost take ownership. But on the other side, the mirror is the first thing that we take as the judge of how we are looking and feeling, and even determines how we're acting on that day or in the years to come. And that's the thing that I want to everybody to say: no, do not. We have to embrace what is within us. And if that day you don't want to embrace the person that looks in the mirror, because it's okay, it's been happening to me. The bags, since I started using glasses, the bags under my eyes are new. It bothers me, but some days I can't. I'm like, what? I don't even want to look myself in the mirror, and I'm gonna get out of here. Some days I'm like, you know what? Just gonna put some tea bags, regardless that there is some microplastics in there, and I'm just gonna feel good, and it's gonna show.
It is going to show.
It's gonna show. And two things before we wrap up that it's just, I'm sure everybody's curious about it. Well, first, you saved me, because when we met, you knew that I was not using retinol. I know everybody is like, this is impossible. It's like not using toothpaste. But, and I'm like, no, I think I'm allergic, because I was very puffy and I was very, and two things to take away home, take away a message. It's one, retinol has to be you have to be educated on how to add it, to put it on your face before you react, because it is supposed to create some inflammation, things that I thought I was allergic to. So I stopped. I'd never used retinol for 10 years. And you always said, I know who uses retinol and I know who doesn't, because this is like, we're almost buying like skin collagen of our youth just using retinol. We are like saving some of that. You want to make a comment on that, because I love it. And my other question before I forget it, and you can just piggyback to the first answer. It's I want your opinion on estrogen cream, and the recent hype. And because I do I treat women going through perimenopause and menopause, and I'm more of a traditional doctor. So many of my patients use their vaginal cream on their face, and we have this conversation, because there is science behind of it's fine, you're not absorbing too much, that you're increasing the amount of estrogen that I've been replacing on you. But on the other side, obviously the pharmaceutical companies are trying to make money out of that, but they say, no, my same vaginal cream is going to go up there. So I would like you to comment on those two hacks.
Yes, wonderful. So the retinol, yes. The difference that I see in the skin of my patients who have been using a retinol for 10, 15, 20 years, and those that have never used it is dramatic. But yes, people can be scared of retinols because it can be uncomfortable. Tips that I've learned throughout the years with retinols. One, you do not need a strong one. You can use an over-the-counter retinol, you can use a prescription tretinoin, but it does not need to be strong. You don't need to use it every day. You're going to skip days. A good tip is that when you put a new tretinoin or retinol on your skin, wait 2 days because the peeling and the irritation is going to happen at day 2. If at day 2 you are okay, go ahead and do it again. If at day 2 you're peeling, you know you're going to have to wait a few more days in between. If waiting days in between isn't enough, we do something called a sandwich method, right? So you'll put a moisturizer first to kind of buffer the skin, then layer on top of that your tretinoin, and then you can, on top of that, put another layer of a thicker moisturizer. And that helps alleviate some of the irritation that can happen. And then the third important tip that I give people when it comes to retinols or tretinoins is don't do it around the mouth so much. The area around our mouth is an area that stretches and shrinks so much as we're animating throughout the day that the skin can crack and break and get more irritated. So if you use your tretinoins or retinols from your cheek back, your forehead, those areas do not get as irritated and peely, and it's not as uncomfortable. And then just once in a while, do it around the mouth. But the key is that we all need a chemical exfoliant if we're interested in keeping our skin looking as youthful and as plump and as thick as possible. So those are the retinol / tretinoin tricks that I've learned throughout the years. I love it. I even mix a little bit of it with my moisturizer. Remember how I talked about my self-consciousness about my arms now?
Yes.
I even mix some retinol and put it on my arms. And yeah, absolutely. You notice the difference. We need some kind of chemical exfoliant at night. Estrogens. I think estrogens are fantastic when needed, right? I mean, in the world of hormones, it's like the Goldilocks story. You know, you can't do too much, you can't do too little, but right in the middle, that's where the sweet things happen. I think that women, if they're going through menopause, need to get their estrogens checked and they need to replace it, whether it's through a cream, a patch, a pellet, whatever delivery mechanism you want. But having optimal levels internally of estrogens are going to save not just our skin, but our brain, our bones, our heart, our mood, you know, the health of our vagina and vulva, all of that, you know, it's going to save all of that. If somebody has their estrogen levels at pretty optimal ranges, I don't think it's absolutely necessary to do an estrogen topically. If you are going to do an estrogen topically, on top of the other estrogen, I would use an estriol, not an estradiol, right? So an estriol is going to be much more localized. It isn't going to interfere or increase the amount of estrogen systemically. And I think that estriols are absolutely fine to use. And I'm of the belief that we need to give our body a chance and experiment safely with things. But I am all for experimenting with things and seeing how we react to it. We're all different, right? And so what works for one person just doesn't work for the other. But as long as you're doing it responsibly and safely, I'm all for trying different things out.
No, I agree. This is almost so much fun to arrive to this age and we have all these things available for us.
Isn't it? I'm having a lot of fun. I
Yes.
really am. I'm 47 and I am so happy where I am right now. You know, I mean, of course I would want a little bit less crow's feet, but I'm as confident as I've ever been. I feel really, really good at this place in my life. And I think that since we're talking about aesthetics, what I said in the beginning of the reflection in the mirror being something that you internally align with, that's when we feel really good.
Yes, yes. I love you are the perfect example of going through this transformation through midlife towards. I had a podcast about the konenki, which is the Japanese concept of wisdom when you arrive to a certain age, that it was given to the women because they were the ones who had all these experiences, and it will have a perfect advice for the community. And also they were not busy anymore raising kids. They are just the backup support with all this knowledge. That is amazing. It is. This is who we are. We should be almost like so honored to be in these moments in our.
Absolutely. I agree. Absolutely. It's a really fun time to live. This phase of my life has been really, really fun. And like I said, you know, just really connecting with the ritual of self-care and loving to love myself has been something that has only happened now in this time of my life in perimenopause.
Yes, yes, we had other worries before, so
Yeah.
we were not mindful, we were not in the present, and
Yeah.
now we had that opportunity.
Yeah.
Mari, has been a pleasure to have you as a guest in my podcast, Double Down with Dr. D. Just before we leave, is there anything else that you wanted to tell to our audience? And also, please, how could they reach out to you? Where they can find you?
Well, I think that looking for a provider, if you feel like you need some help navigating the way that you look and feel through menopause, looking for a provider that has your best interest in mind. You know, there's a lot, especially in aesthetics, there's a lot out there that, you know, you have to be careful with. So making sure that you feel a good connection with the person that you pick to help you navigate through this phase of life. And how can people connect with me? Well, I have my practice in Weston, Florida. My practice's name is Indie Health. You can look us up online, indiehealth.com, Indie Health on Instagram. And yeah, we'd be happy to meet anybody interested in coming in.
Awesome. So for my audience, thank you so much for listening. And this continues this series of transformation through midlife. I'm telling you, I'm finding these awesome models that we all can relate to, empower us as a women. We keep our authenticity, gives us tips to stay beautiful and to reach even more beauty. And we all get educated and we all going to be very comfortable within our skins, inside and out. See you next.
Thank you for listening to the Double Down podcast with Dr. D. If today's episode inspired, empowered, or gave you a fresh perspective, please don't keep it a secret. Subscribe, leave a review, and share it with someone who's ready to take their health to the next level. Stay inspired, stay committed, and I'll see you next time.